We'll talk about imaging of the anterolateral ligament with MRI. There was a lot of recent interest in this subject. If we look at PubMed, we will see more than 100 papers published since 2014. And a lot of good papers from US, Canada, Australia, Europe, South America, Asia. So all of them dealing with MRI evaluation of the ALL. So we will talk about some important subjects in this lecture regarding identification of the anterolateral ligament with MRI. And the first question is it possible to identify the ALL using MRI? We started to look for that in 2013. We did several studies and we found that for a proper identification, you have to use the coronal and axial sequences side by side. And we have to use the lateral inferior genicular vessels as the ALL bifurcates just proximal to it. So by using these tips, you can find the ALL in almost all cases. But we were not sure if we are seeing the correct structure. So we did this correlation study. We did the MRI in the cadaver knee, and then we did the dissection and compared the measurements. And we published that showing that the MRI was able to identify the ALL anatomy. You just have to be careful with small knees, especially patients under 14 years old, because of a lot of partial volume effect, as it's a tiny structure. Sometimes below 14 years old, it's not easy to find this structure properly. Then the question is, have you ever injured the ALL? This great paper published by Professor Ferretti and Eduardo showed that in anterolateral exploration, you can find around 90% of anterolateral complex abnormalities. We tried to do this same search with MRI, and we published that in 2017. But at that time, we could only identify the abnormal ALL in MRI in around 40% of acute ACL tears. This was in adults, and we did that for adolescent patients from 14 to 17, and we could find around 60% of ACL tears. So when I present that in Shanghai in the ISACOS Congress in 2017, I said that MRI does not yet present the accuracy of the macroscopic evaluation for these anterolateral lesions. So we started to do some special protocols. We did this bilateral MRI study in acute ACL tears, and by doing this, we found 88% of abnormalities when we compared the anterolateral side of the injury knee with the normal knee. And we also did this 3D MRI study in which we could show 87.5% of ALL abnormalities in acute ACL tears. We also did a correlation study, again, together with Eduardo and Professor Ferretti, showing that there was a high rate of ALL tears in acute ACL tears, in acute ACL injuries using anterolateral exploration. And we found a good correlation between anterolateral exploration and MRI, showing that MRI is a good tool to evaluate the injury ALL and also the injury ITB. But why MRI evaluation of the ALL is so important? It's because when we find an ALL injury in MRI, normally it correlates with not only high-grade pivot shift, but also high-grade Lachman tests, as we show in this case. And also, it was just accepted by AJSM a few weeks ago. I hope it will be online soon. We did a correlation study between an ALL lesion in MRI and isolated single bundle ACL reconstruction. We evaluated 182 patients, and we showed that in patients with an ALL tear, they present worse IKGC and worse lesion scores, and also higher re-rupture rate, showing the importance to recognize an ALL lesion in the preoperative scenario. A small word about second fractures. There's a lot of controversy regarding which structure is responsible for this fracture. We did a multi-center study with Steven Kleis and our Belgian colleagues, showing that the ALL was attached with the ITB in the second fragment in around 52%, and the ALL was attached in isolation in 48%. But another important finding of this study was that Even with the second fracture, there was a lot of associated lesions to the anterolateral structure, not only the ALL, but also the ITB. So we need to consider that when planning our patient treatment. ALL healing, of course, we need MRI to study ALL healing. This study of our friends from Korea showed that the healing is poor. Around 70% of the patients, the ALL does not heal properly. We are doing a similar study to confirm these findings as well. This is a nice picture showing an ALL healing. This is this is after injury, and this picture in the middle after reconstruction, and this after 1 year showing proper healing. In MRI, of course, we need to study the function of these structures. And we need to train ourselves in post-operative MRI and also other imaging evaluation methods, because as these reconstructions are becoming more popular, we need to understand how to deal with it in post-operative MRI as well. So as a conclusion, of course, it's possible to recognize the ALL in conventional MRI. Special protocols can improve visualization if we are in doubt. Maybe we can select the patients in which we are doing that. An ALL lesion in MRI is correlated with more pronounced knee instability and also ACL reconstruction failure. So we have to be careful with that. And the ALL healing so far is quite poor.